From here, so yeah, dad doula roles. So let's take a look at this again. So I think she's a doula, mom and dad. Yes, I think dad is doing his best for sure, and this dad also. Yeah, just by being present and, just, supporting mom so she can have a more comfortable position and whatnot. But while I was just looking for all those images and videos, I thought these dads, although they're doing their best, I know, I'm sure, but I thought they looked kind of like robots, like they don't really know what to do. Yeah. So I really want dads. Are there any dads who's having their second or third child? Or you guys, you're all new parents to be's? 다 초산이신가요?
All new baby parents.
Mm-hmm. Yeah, July due date first child son. Yeah, IVF. Yeah, congratulations. Yes, coming soon. Yes. So, I mean, parents who have gone through this already, they kind of know like what to picture, but for new parents, they don't like they usually don't have any ideas uh, unless they really studied with Sunsan Pilskosu and whatnot. Yes, Christian, first child girl, congratulations. Yes. So I think it's really important for dads to picture what they can do, like, and actually prepare what they can say to their lovely wives who will be going through labor and birth, which is a big, big life deal, right? So rather than just being like a little robot, I will tell you what to do step by step today so you can be her best supporter. Um, I loved this couple. They had their first baby this January, actually, and in Korea. I was in Korea supporting them as a birth doula, and um, they just did this so naturally. Like dad proactively, this dad just hugged his wife and just held his wife's hands and like did that little hand massage and played the music for her and did the slow dancing with her, did the back rub while he was doing the slow dance. So it was so beautiful to watch as a doula. So mom felt so relaxed because being able to relax is so important for fast, short delivery. So yeah, it's just being able to relax with all those different positions and by breathing together and being in different positions together. So yeah, so just like that, picture yourself being there in the hospital room and in your place as well. And yeah, this also so shower of oxytocin, right? You moms will need a load of oxytocin for faster labor and delivery. So what dads can do is rather than just standing there and, oh, what can I do for you? But you just proactively ask, what can I do for you? But I don't really like the wording, what can I do for you? Because moms will be I know my Sunsan Priscos moms will be more relaxed because they're quite ready for their birth, but many moms they don't really know what to expect. So some moms panic, they like pant like they go like that, hyperventilating. So some dads, while like looking at their partners going hyperventilating and like going in pain so much, they panic together. Oh my gosh, I don't know what to do. I don't know what to do. So they just ask for nurse, doctor, midwife. What can we do? I don't know what to do. Just epidural, right? So rather than panicking together, yeah, just be there for her and guide the breathing. 중간에 너무 멈추지 말고. Yeah, did you just see the gesture that Dad just did? Yeah, yeah, he's using the hand movement like inhale, just like going up on an elevator, and whoo, exhale down the elevator. So you can use the gestures and you can just say, oh, okay, inhale for one, two, three, four, five, and exhale for one, two, three, four, five. So you can give her some game plans. So that's what dads can do. I'll show you all of those techniques a little later, and let's talk a little bit about this. So, when to call the hospital. I know some parents are from Vancouver. Where are you guys from? And I know Bella 사모님 is in Busan, Korea right now. 어디 계세요, 지금? Where are you having your baby? Oh, Port Moody, yes. Virginia. Hmm. From Ecuador, living in Mexico. Oh, Mexico. Yes. Yeah, yes. Seattle, but going to Busan. Oh, okay. Yes. So, yeah, oh wow, many different cities and countries today. So, yeah. So, for North American hospitals, this is the scenario. For Korean births, it can be a little bit different, but 거의 비슷해요. 네. So, when to call the hospital. So, four scenarios. So, when dads see all these signs. So it can be just one sign or like two or all of those four together. I don't want you to go through all fours because excessive bleeding is not the best sign. But yeah, one or two, right? So regular contractions, usually for first time moms, it's usually 411. So what that means is this. What is 411? So you can just call the hospital. It's usually the dad's rule to call the hospital while your wives just take rest. So call the hospital. My partner's name is la la la, and she's 411 or 511. So what does that mean? So all these waves, they represent contractions. Yes, you're gonna hear the words contractions a lot at the hospital. So contractions meaning the uterus will literally contract, squeeze to push the baby down and out, right? So it's gonna squeeze. So this wave means one contraction, and um, this line means period, rest. It's a resting period, it's a break, and then one more contraction coming, and then a little break. So please download one of those free contraction apps, and you can just press start. Oh, a contraction start. Okay, start. So start to another start. So from this start to another start. Oh, okay, there is a 4 minute interval. Again, this start to the next start, again, around 4 minute interval. Yeah, that means it's four. And this middle one means one wave of contraction lasts about 1 minute. Lasts about 1 minute. And this last one means this whole waves of contractions, when you put them all together, it's lasting about 1 hour. So 4 minute intervals, one being around 1 minute, lasting for about 1 hour. So that means 411. So you can just call them and say, oh, my wife is 411. So likely for first time moms, yeah, definitely they'll have you over and check you. But different providers say different things, but this is just the average. So check with your own provider, please. So whenever she's having a contraction, I actually like the word waves a little more. So it's just like waves, really. Like, oh, waves rolling in. Ooh, all the way to the peak and rolling out. And peace again for 2, 3, 4, 5 minutes. And another wave rolling in. So yeah, a lot of waves you'll be yeah, experiencing together. So whenever moms have contractions, waves, this is what's going to happen. If dads can tell me what kind of differences they can see from these two pictures, can you please type on the chat? Any differences that you can spot from these two pictures? Yeah, definitely. The baby is lower and squished. Yeah, it looks a little bit squished in the head. Yeah. Dilated. Yes. Oh, you know the word. Yes, dilated. So, and closer to the exit. Yes, I like the word exit. Yes, yes. So dilated meaning the cervix is way more open than the left one, right? Yeah. Wonderful. Thank you. And there's actually one more important thing. One more important thing. Ta-da. Hint. The upper part. Can you tell the difference? Placenta moving with baby. Oh, actually I've never seen that answer from dads. Oh, yeah, because baby is lower. I think placenta is also lower with the baby. Yeah. Ooh. Good observation. Yeah, contraction. Yeah, definitely. Mom's having a lot of contractions. So I'll tell you. So this whole big thing is a uterus, right? So it used to be a fist size, but I mean, for July due date babies, for moms, their uterus is like the size of a watermelon now, so it's really big. So when you take a look at the top part, which is right here, the upper belly part. So whenever mom's going through a contraction wave, it's gonna the top part of the uterus, which is called the fundus. This fundus part will build up by layers and layers. So it used to be like this thick, but for I mean, moms will have hours and hours of contractions usually for especially for first time moms. Then their fundus will build up. Yes, so it's gonna get thicker. Can you tell the difference? Yeah, it's a little bit thicker. Yes. So the thicker part of the upper uterus. Hi, Aurora. 안녕하세요. Yes. Yeah, that part will give the uterus a lot of power. So a lot of power. That powerful top part of the uterus will push the baby down, 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 and out. So whenever moms have contractions, there is a meaning. There's something actually going on that you can't quite see from outside, but there are many things happening inside. This dilation, which, yeah, Christian mentioned. Yeah, cervical dilation. So every minute, every hour, something is happening little by little. So undilated cervix looks kind of like a donut cushion or a donut. So it's really for first time moms actually, how undilated their cervix maybe is this. It's usually a pen tip size open. So their cervical opening is really tiny because you don't want your baby to come out too early, right? So it's tiny, but with all those contractions and power, right? It's gonna get big. The opening will get bigger, 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 all the way to 10 centimeters dilation. Yes. So from the pen tip to like all the way. So that's gonna happen inside. Yeah, visualize, right? So for the super dad, what super dad, super husband can say to their wives. So please, you can capture this so you can kind of memorize all these lines. Yeah. So confidently narrate the moment to your lovely wives. So, babe, contractions are now 2 minutes apart, and doctor said you're at 8 centimeters. Wow, that means our baby is coming down beautifully. You're such a strong woman. Yeah, you can just say things like that rather than just saying, "Oh, good. Oh, you're doing well. 잘하고 있어. Good, good, good." 그냥 이것만 하지 말고 you can say, different things, especially narrating the moment. Then mom will their ears are really open. So whenever they're having, even when they're having, going through a tough, really a tough contraction, a powerful contraction, still they can hear things very well. Yeah, surprisingly. So just narrate all those by her side. It's gonna encourage her, really. Hmm. Stages of birth. So I want us to know these. So from early labor to all the way to pushing. So there are stages of birth. So early labor, active labor, and transitional labor. So three parts of labor. And then when the cervix is fully dilated to 10 centimeters, then, and when also the baby is down low enough, then moms can start pushing. I have a question for that. Can you guess how long the early labor may be? So early labor meaning cervix is open from 0 to 6 centimeters in dilation. So from 0 to 6, how long for a first-time mom? Early 6 hours. Yeah, good guess, good guess. 12 hours. Ooh, 6, 12. Good guesses. 그 정도? 네. Okay. So early labor for first-time moms could take around 12 to 18 hours. I know your eyes go like, oh, are you serious? So it'd be nice if it's shorter, like 6 hours. Yeah, it'd be really wonderful. I know. Yeah. But moms, moms, wonderful moms, 정말 대단한 우리 strong moms, you're already going through a long, term pregnancy. It usually lasts around 40 weeks, right? So it's not like 14 weeks or 4 weeks, it's 40 weeks. Wow, it's a long time commitment, really. So your human baby won't really come out like that. So it takes time. It's a time-taking experience. Yeah. So early labor, it can last like so. And how about active labor? So cervix open from 6 to 8 centimeters. Any guesses? Yeah, it's definitely shorter than 12 to 18 hours because it's 6 to 8. 8 hours. Yeah. 6 hours. It's shorter, so it's wonderful. In active labor, will it be in 411? Yeah, that's a wonderful question. So usually when mom hits around 411, moms are usually in their active labor. Most likely. Most likely. Yes. So active labor for 3 to 4 hours. How about transition? So cervix open from 8 to 10. 8 to 10, all the way to the full dilation. 45 minutes. Oh, that's a really good guess. 2 hours. Yeah. So 1 to 2 hours. So I know some dads, they really love numbers. So you can kind of memorize this. So early labor was really long, early labor and active labor and transition. So it gets shorter and shorter, which is wonderful. And pushing. How long? How long to push this baby out? My last number question. Yeah, 30 minutes, 1 to 8 hours. 1 hour or 8 hours will be a killer. It's usually 1 to 2 hours, 1 to 2 hours. Yeah. Actually, I just checked my DMs. Um, like 2 hours ago. I I had two moms, two Sunsan course, our course moms who just gave birth to their babies 오늘 today. Yeah, and they all 순산했어요. 순산하셨고 one mom actually just pushed for 15 minutes. It was her second child, so it was a little bit faster than the first, but still 15 minutes of pushing. So I was like, oh my gosh, you're amazing. Yeah. So it can be shorter or longer, but this will be your average. Yeah, take a look at this. It's gone. So it means that you can just do a lot of things, especially during early labor when you're home. Yeah, you can even do skincare during breaks. Yeah, I was just being really silly. So I really wanted to show new parents that early labor, especially when you're staying home, you can do a lot of things because you will be getting a lot of many breaks, a lot of breaks. So one break can last about like 5, 8 minutes. So you can really like eat pop and you can just walk around. Yeah, walk around because even when you're outside, you can still walk around outside because your breaks will be quite long and your contraction will only last about a minute. So for about a minute, you can just stand like so and breathe together and oh, it's gone. Ah, I feel normal again. And then you do whatever. So yeah, can do a lot of things. And super dad tip again. So the power of redirection. I think this is really essential to remember. So rather than just focusing on the pain, oh my gosh, are you okay? Rather than that, just redirect your wife's attention to, oh, I'll breathe with you. Okay, let's do this together. In there for 1, 2, 3, 4. Oh, you want a sip of water? And oh, I brought this for you. Do you want a hot pack? I can just, yeah, warm this up for you and bring it to you for your lower back pain. So you can just say things to redirect her attention. So that this really works. Um, so that was about early labor, many things you can do at home. And once you hit active labor, so cervix is around 6, 7, 8 centimeters dilated. So most likely, unless you're giving birth at home, you will be in your hospital room. So active labor, being in different positions is very important, right? So gym ball, standing. She's sitting on the gym ball also, and yeah, just walking around in the hospital, like aisle. So you can do many things in the hospital as well to change things around and changing positions and stuff. And this also, dads should take the lead rather than just waiting for your wife to say things and order things for you. Uh, just take initiative and oh, why don't we walk outside? Do you want to do that for 5, 10 minutes? Oh, let's do that. And oh, I can bring you a gym ball, birth ball. Do you want to sit down there? So just proactively bring all those game plans. Yeah, so be proactive. I love this word. Be proactive, dads. So, did you want to change your position? It looks like your low back hurts because you usually have a lower back pain. So I can bring you a birth ball, a hot pack, a stress ball that I brought from home. You want them now? Yeah, so be proactive rather than just waiting for her to order things, right? Yes. And the third stage of labor will be transition. Remember, it's the shortest part of labor. This is the shortest, and this is the most intense part of labor. But if mom chooses to have an epidural, then uh, most likely she will just skip this transition part. She will go through this, but she won't really feel the sensation. Yeah. So transition, whether you had your epidural or not, this usually lasts around 1 to 2 hours. And what can you do during transition, especially without epidural? This is the most intense part, the most. But thankfully, this is the shortest. I've seen many dads like who uh, had been a wonderful supporter, like being calm and proactive during early labor and active labor. But once mom hits transition, then her breathing pattern changes and the way she talks may change. Like she can make like growling, like animal, sound. So dads kind of starts to panic together. So yeah, transition 정신줄을 같이 잡아야 돼요. So what can dads do? 자, 음, yes. So with rather than being soft and nice and calm, that also works. But during the transition period, I want dads to use some reassuring words with a strong, strong voice and with an eye contact. Hey, babe, look at me. Look at me. We've got this. Our baby is coming very soon. You're almost fully dilated. Baby is coming soon. So, with the very reassuring words and voice, right? And just one contraction at a time. I'm right here for you. Just tell me anything. Okay, Jamie, is it okay to make them laugh during that time? Yes. Very. Yes, I love that. Yes, just make them laugh, really. Uh, uh, making them, I love that because their hormonal change will happen. Like when they laugh, can you think of the word, the hormone when you laugh? And that's so funny. What's the key hormone that you will have in the body? 호르몬, 엄마들도. estrogen. Good guess. 웃을 때 나오는 거 있잖아요. Dopamine. Oh, that's a really good guess, but not dopamine. Oh, oxytocin. I love oxytocin. 이거 정말 나와야 되는데. Endorphin. That's right. Yeah. Three people straight. Yes, endorphin. So moms will have a wave of endorphin when they really have a good laugh. Yeah. So what you will need to have for effective and fast labor and birth, endorphin and oxytocin. These two are the key hormones that you would want to have, but not the maybe not the dopamine. dopamine. 네. Or adrenaline, the stress hormones. You don't really want too much adrenaline. Then it's way harder for moms to relax their bodies when they really want their body to, especially the down part, to relax and open. But when they're like all tensed up, oh my gosh, that really hurt. Then like, oh, tension is up, stress hormone up. Then oh yeah, it's not gonna. Uh, then you will experience more pain, more tension. The last one, that was a tough one, babe, but you handled it like a champ. You're so strong. I respect you. Oh my gosh, you're such a strong woman. So use an eye contact, please. Okay, the last part will be the pushing. I mean, pushing can look very different. Yeah, so that was me with my second child. Looks scary. Um, but I've been a doula for the last 7 years, and I've seen many, many births. And this is my favorite part, the pushing part. But we're all like looking forward to actually really finally have this baby out in the world and like actually see the baby's face and touch the baby finally. We can finally hear the baby's voice, like, oh my gosh, 너무 heavenly. I think it's a heavenly experience, really, to finally be able to hold your little one. Yeah. So right before that actually happens, so it's the pushing, amazing pushing. And I think this is the moment for you moms and for you dads too. So whenever I witness all those like pushing phases for moms, I always think, wow, this is the most empowering moment of a woman's life. I always think that. So moms are so strong. They didn't even know that existed in themselves. But wow, they have so much power, and maybe their energy level could be low after like a long period of labor for maybe they experienced like 20 plus hours of labor. So maybe their energy level was low, but once they start pushing, they're gonna have the second wind of energy. Like, oh, I'm gonna meet my baby finally. So yeah. So pushing. So when your wife's pushing, oh, I wanna go through this too. So before you actually enter the birth room, please. Especially, I know there are many babies who are coming really soon, within a month. So if you can start doing this, it'd be really wonderful. So perineal massage. In the course, I explained like what to do and how to do this. So you can, I know it's all in Korean, but 엄마들이 좀 옆에서 네, 설명해 주시면서 you can guide your husbands to do this for you. So you can do this on your own, but the angle may be a little bit tricky because you have a big belly with your baby. So yeah, it'd be the best if partners can help. So yeah, so basically with two fingers, you're just gonna it's not just like gentle touching, because the gentle touching, it's not gonna do anything too much, but you're gonna stretch. So let's say like this is the vaginal opening, so it's not like ha 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 ha, but you're actually going like this. So stretch this part, stretch the opposite part. Yeah, not too strong, but ooh, just check how she feels, and is this okay? Is this pressure okay? Like, yeah. So it's not just the superficial surface massage, but if you can just stick this one little 이걸 뭐라고 하죠? 영어로 마디. 네, 손 한 마디. If you can just stick this part in actually and do the stretching, yeah, that'd be wonderful. That can really help relaxing the perineal muscle before, yeah, giving birth. Um, 네, and then, oh, I already showed you. And then what? So after all the labor stages and pushing, and then what? Something will come out after the baby. You know what that is, Dad? So after the baby, something will come out for sure. Poop or placenta? Oh, it's both the P words. Okay. Oh, poop이라기보다 placenta for sure. Yes. It's a very short video, so please. 뭐예요? Uh, take a look at this one more time. Yeah, you saw that? So that was a placenta. So placenta, all moms, obviously, they have placentas, and they are gonna come out after the baby. It's usually with just a gentle push within 5 to 30 minutes after giving birth to the baby. Yeah, it's so it usually comes out really smoothly. Just like you giving poop almost. Mm. So placenta will come out, and then your doctors and your or midwives they will ask, "Hey, Dad, do you want to cut the cord?" Hmm. So if you are willing, and if you say yes, then they will give you a pair of scissors, and then you will cut your baby's umbilical cord. You can discuss like what timing of the cord cutting may be optimal, because there are certain not the rules, but guidelines that's out there for delayed or optimal cord clamping. So many years ago, and still in Korea, I know in Korea, they do this really quickly. So as soon as a baby's born, they usually just clamp the cord to stop the blood flow, and then they just asked the dad to cut the cord almost right away. But I know like all those research, it's been updated for the last many years. So many healthcare providers, especially doulas and midwives, they say, please wait at least 1 minute up to the cord turns white almost. So the baby can have all that blood, which has, nutrients, oxygen, iron, and all those goodies. So the baby can have all his or her blood from the placenta. How can I ask the Korean doctor not to do that? Will they listen to you? Yes, Korean doctors. So I know some of the doctors can be really stubborn, not just Korean doctors, but other doctors too. So I think it's really important for you to have this conversation ahead of time, rather than just at that moment, because they're gonna be like, oh, 정신없어요. So please prepare your birth plan. Mhm. Birth plan. So you can just talk about your birth plans. I want an optimal cord clamping, and I do not want, for example, like the cutting of the perineum, episiotomy, or I do not want la la la. So you can show your plan to your provider ahead of time. That can really help. Hopefully, they listen to you too. Mm. Comfort techniques. So please set this up for your lovely wives. So set a room for her. So a peaceful room with music, peaceful music, or like even meditation music. So kind of like this. So, ooh, very cozy, warm, right? So, I feel like having a baby, right? So, I feel so relaxed and cozy. I think my bottom will open up and relax more easily with this wonderful, beautiful, cozy atmosphere. Yes, Jamie, is it okay to have the doctor to add the eye Vaseline when the baby comes out? Yeah, they'll definitely apply the eye ointment. This is a almost a protocol that all doctors will do for the baby. Oh, if you don't want the ointment, they will definitely ask and probably explain what the risks and the pros and cons are. I know, like I know many North American hospitals now they give you an options, but even like 5 years ago, they it wasn't an option really. But to usually recommend. I got my two children to have the eye ointment because I know like moms will most likely usually they know like what kind of like bacteria, if they had any bacteria in the vaginal area, they would know like what kind of things I have or I don't have. But sometimes like bacteria, like things could develop during the last month without mom's being aware of that bacteria. So, yeah, for the safe safe measure, I think many doctors will recommend to have the baby's eye ointment rather than yeah. So I can't really say yes or no, but so if you're 100% positive that your body's fine, no bacteria, no GBS bacteria or whatnot, then you can say no. Hmm. So yes, oh, you did some study for sure. Good, good. So comfort techniques, so peaceful room, music, meditation, and proactively offer position changes. Just bring a birth ball for her to sit on. So just like this. Moms don't have to lie on bed for the whole time at all. That is not recommended at all because it's going to slow down the labor most likely, and moms will have way more painful, especially the lower back part if they're in bed for the whole time. So please use all these upright positions. And yeah, I love using a birth ball. I'm pretty sure all North American hospitals, they have birth balls, many birth balls. But for Korean hospitals, please check ahead of time if they have any available at the hospital. So just sit there and you can just give her a massage or just constantly be there for her. Just talk to her and give a little, gentle rub. And yeah. So birth ball is awesome. It's a wonderful pain reliever too. And massage. A lot of moms love getting massage during labor, but some moms don't. So please ask. So always check with your wives. Is this pressure okay? So if she's comfortable with that pressure level, then you go ahead. But sometimes they don't really want you to touch at all. Just no, don't touch me. 만지지 마. Then okay, just let her be. Just let her be in her own labor land. Mhm. But if she does like the massage, this is the go. Uh, yeah, this is the go. The double hip squeeze. Yeah, I love this position a lot. So please use this part of your palm, the lower part of your palm, and go like so. Inhale together, relax, and as you both exhale together, counter pressure. So moms will feel a lot of relief because baby's coming down, 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 all the way like in the pelvic area, and moms will feel a lot of pressure down there, like this part especially. So applying counter pressure can really help relieve that pressure pain. So please practice this at home ahead of time before you actually head to the hospital. Lastly, breathing. I think if I could only choose one comfort techniques of all these, and I know there are a lot more other comfort techniques too, but I would choose breathing. So I love the breathing technique. Just by going through 3, 4 rounds of breathing, a lot of moms, they're gonna go like this. So before, let's say their shoulders were like all tensed up, and like some moms, their even fingers and toes, their toes are all curled up with a lot of tension and stress. But with that breathing, their shoulders will relax and open, chest open, and their facial expression will change, and just body will really relax with, yeah, good rounds of breathing. So please lead that as a dad doula. So this is accounting. Please take a look. So inhale, this represents inhale. So inhale and exhale. Take a look. Inhale, exhale. So, as you could tell, it's not that short. It's pretty long. So, it's very slow and long breathing. So it takes practice, especially with the big belly and the baby. So moms definitely needs to practice, and dads also, because you would want to do the counting or the hand gestures, and so you can use different techniques and words to guide the breathing for moms. So if you're together, I know some parents are they're located separately right now, but you can practice together. 자, 같이 해볼게요. So let's do this together. So you can do the counting. So for the counting, inhale for one, two, three, four, five, and exhale for one, two, three, four, five, six, seven, eight. So 5, 8, 5858 breathing이죠. 5, 8, 5, 8. So let's do this. 시작. Through your mouth, through your nose, inhale. Relax your shoulders and relax your bottom one last time. Expand your lungs and slowly exhale that air out. Yeah. So without looking at this, just imagine that you have that circle on your forehead and just try to relax entirely. Just relax your shoulders and neck. No tension anywhere. Not even your face. Your face is really relaxed. Just like as if you're sleeping. Your fingers, your 10 toes, no tension. And we're gonna sigh it out. And slowly inhale. 2, 3, 4, 5. And exhale. 2, 3, 4, 5, 6, 7, 8. And inhale slowly. Exhale. 2, 3, 4. You melt down. Open your eyes. Yeah, so good rounds of slow, deep breathing will really calm everything down. This really works. Okay, so baby's out, placenta's out. Now it's the postpartum phase. Postpartum. Um, There are a lot of postpartum dad roles for sure. So, moms, she just went through a lot. I mean, together you went through a lot, but yeah, physically, mentally, mom really went through a lot. So, she really needs to relax and recover while she's in the hospital and while she's at home, right? For at least what period of time? Do you know the postpartum period? The recovery period? Do you know how long that is? That's ooh, 6 weeks, 2 days. Oh, there's a big difference. 6 weeks, 2 days. It is 6 to 8 weeks. Yes, 6 to 8 weeks. So for moms who have gone through a vaginal birth, that's usually 6-ish weeks. And C-section moms, it's more towards 8 weeks and longer. Yes. So that's the minimum. That's the minimum. So 6 to 8 weeks, it's a recovery period. It's not like 6 days or 2 days. So moms really needs to recover. So dad, what can you do during the postpartum period? I know um, you'll do a lot for your wives and your babies. So can you just think of the tasks that you can do, like everyday tasks, so moms can really rest. Kiss her, hug her, cuddle her, cook. Oh, I love that. Oh, I want to capture that. Watch the baby. 누구 남편이세요? 우리 벨라사모님. Oh, she's happy. Oh, oxytocin and endorphin, right? Yes, good. Yeah. Bathing the baby, I think that's really important. Buy her fried chicken. Oh, that'll make her happy too. Sushi. Oh, you know her so well. Hmm. Yeah. So, I mean, yeah, just be present, right beside her, right? Just to cuddle her and ice cream. Yes. Oh, 차가운 거 괜찮으려나요? I know, like, I would always recommend moms to have some warm food rather than cold food, but I know just a little spoonful of ice cream won't really harm the mom. So, yeah, even coffee too. So, please just still stay proactive and take initiatives, Dad. Happy wife, happy family, right? So, welcome to parenthood. Uh, Yes, so this is the one that I talked about, the birth plan. So there are so many options that you wouldn't really imagine that these lists of things existed, right? So from what kind of heart rate monitor they can use, or comfort measures, or medical choices. So there's so many birth positions, and there's so many things you can ask or not ask for pushing medications for baby after baby's born. So there's so many things that you can ask. And you can just check all these things. And for this, I really want this to happen for my birth. And I really don't want this for my birth. So you can check all this and discuss this ahead of time with your partner. And yeah. So birth plan, we do have this birth plan live class every month, every first week of month, usually Friday evening. Yeah. North Korea, North Korea가 아니라 North American time. Yes. So you can always come, but I know it's done in Korean. 아, 영어로도 해야겠네요. I'll do this in English too. Okay, so July. Wow, it's almost July. Unbelievable. So next